Before we get to our official first speaker, I've got Treena Duncan here from the CCA National Board. Thanks for joining us today, Treena.
Happy to be here. Thanks for having me.
Treena, not everyone may on this conference today might know about CCA, and the National Board went through some strategic planning session. Can you tell us a bit about CCA and its priorities and our mission?
Sure. And first, I'd just like to thank everybody who's with us today for this event, and for our partners helping us to bring this event to you today. Clearly, the COVID pandemic has changed a lot of the way that we're working and living, and so we're really, really excited to be able to offer this this program online. It's too bad that we can't gather in person, but it also offers the opportunity, perhaps for some of you who may not have traveled to Saskatchewan, to join us and to learn with us today. Thanks very much to you, Melissa, and to Mark for putting this all together, and especially in such a short timeline, so it's really appreciated. The CCA's mission is to empower Canadians with celiac disease and gluten disorders to live their best lives. Events like this that bring top researchers, educators, and experts help our communities to learn about the latest news in management and treatment, which will help us indeed to live our best lives. The board has been working really hard lately to develop a new 3-year plan and to review its key priorities. Of course, we are a small charity, and there's so many things that we'd like to be able to do, but it's really important that we focus our energy and our resources so that we are able to do the things that we prioritize really, really well. So the things that we have prioritized for this year, the first thing is that we really want to focus on promoting evidence-based solutions. So this priority is rooted in CCA's long-standing tradition of being a science-based organization. Our Professional Advisory Council, or PAC, is known around the world for their evidence-based reviews, leading position papers, and they help us to develop education material and resources. They also steward our J.A. Campbell Research Fund. We look forward to continuing to make advancements in helping to improve our lives. Another priority is to strengthen standards. We want to ensure that we have access to safe food. This is a paramount thing for us. Our gluten-free certification program is one of the strongest food safety management programs in the world, and it carries our trademark. It gives people confidence that the product that they're eating is safe when they see the trademark. There continues to be an issue with may contain statements on food labels, and we continue to advocate with Health Canada officials to ensure food regulations continue to be modernized and to protect our food. Work continues to be needed in the area of food services, including restaurants, seniors' residence, and public facilities like hospitals. We also are working to build collaborative relationships. In order to make advancements in patient management, diagnosis, and in research towards treatments, we need to build partnerships with healthcare practitioners. We need to work together with other disease groups and pharmaceutical companies who are leading research, along with staying abreast of international best practices through meetings with other international groups. We also want to ensure the financial sustainability of our organization. It goes without saying that in order to continue the work, we need to be financially stable and we need to grow. Over the past number of years, the CCA National Board reviewed its organizational structure, and we decided to move away from a membership model towards a donor model. The move is to align our work with our charitable purposes to support and advance the celiac community. And finally, we want to increase awareness and education. The more knowledge we have about our disease, the better outcomes we will all have. It is estimated that 80% of individuals at risk for celiac disease or gluten disorders are still undiagnosed. Our celiac awareness campaign helps the greater public to understand more about what we face on a daily basis and to alert others to the signs and symptoms of the disease and help them get the care that they deserve.
Thanks, Treena. Certainly, it's an ambitious plan, definitely, for CCA. And I think in terms of some of the work that we're doing, COVID has certainly made an impact on everyone's lives, and the CCA has learned to swing in despite our small size. And we have responded, despite our small size, and quickly changing conditions, and we've rallied to help our community. We identified vendors that were offer at home food delivery, ways to support dining establishments through takeout. We've been in communication with Health Canada and other stakeholders, working to help those most at risk in our community who need access to services such as food banks. We've been monitoring food availability and reaching out to food manufacturers. Unfortunately, receiving gluten-free food can be a real challenge. And some people have had to decide between going hungry and going without food. We've been working with our chapters and making sure that we can get food to the people who really.
Melissa, your microphone is cutting out a little bit.
Yeah, I've just gone to. Can you hear me a bit better now?
Yeah, you're a little distant, but we can hear
Okay.
you. At least you're not cutting in and out.
Okay, all right. I think it might be some of our internet. So I think we were doing good for a little bit there. What I'll do is I'll try and speak up, and then
This is better.
And I'll try and switch to our phone. So unfortunately, and we just want to kind of go through some, just highlight some of the education things that we're doing. We're able to provide community support. Thanks to our donors, we're able to bring smaller education webinars other than the big one like today. We run the monthly GF 101 sessions where we are now sponsored by SHAR, and they're offered by a registered dietitian. And I think Treena wants to make sure she sees me, so I'm going to start my video again. Some peer support. Our generous monthly peer champion donors have allowed us to ensure that individuals who need one-on-one support can receive the help and advice that they need from a peer support network. And we also have a great Facebook group. Treena, do you want to tell them about that?
Yeah, our Facebook group is a really great place for people to come together and connect with the gluten-free community. It's a very active group. Lots of people are on there, and it's a great place for community as well as an opportunity to learn. I'm actually on there pretty much every day, and it's really a safe place to share your challenges, recipes, great finds, and really just to ask questions of other people with celiac about their experience. We do moderate the group. And we have access to the PAC, the Professional Advisory Council, to respond to questions if things come up that we're needing to get some professional guidance on.
And we've got some, to help empower our community with education, we also published an e-newsletter called Better Living Gluten-Free. And an e-magazine, Canadian Celiac, that goes out 3 times a year, February, May, and November. And these resources are filled with evidence-based information, lifestyle tips, current research experts, again, more recipes because it's all about the food. So make sure you sign up to get these in your inbox. I'm just kind of watching our time here. We've got a great resource for families called Growing Up Celiac. We launched last year for parents who have children who are newly diagnosed. It's sponsored by Udi's Gluten-Free, and this resource is free thanks to our partners through the CCA, filled with tips and advice from other parents as well. And we've got some great videos on our website as well. And Treena, maybe you can let us folks know about our upcoming spring campaign.
Yeah, so that's, I think the thing we want to close with here is that May, in case you didn't know, which I'm sure you do, is International Celiac Month. And so we want you all to wear your green ribbons to help us to create awareness about celiac disease. So we are also launching our annual spring giving campaign during this time. We know that for many individuals, this is a tough time, especially with COVID. But for many charities like CCA, there has been a direct impact on our donations, and we have needed to scale back our operations in order to weather the storm. So to continue the advocacy, education, events like these, and support services after this pandemic is over, we will need your financial support. Many of you have contributed to this event with a donation, and we're really grateful. So thank you very much for giving us a jump start on our campaign. Our goal is to raise $50,000 by the end of June, And with your help, we will continue to empower more lives with education, support, and investment in research. Thank you very much for being here today. Thank you again, Melissa and Mark, for your leadership in this area. And I'm really excited to hear from all of our speakers today. So let's move forward with that.